Good afternoon, everyone, and welcome to this Khipu 2021 event series in artificial intelligence. And I'm really excited to host today's event. My name is Daniel Belgrave, and I'm part of the Khipu team and also research scientist at DeepMind. And I'll be very briefly telling you what you would be prepared for today. So today we're going to have one of our conversations in AI. And these conversations, for those of us who are joining us today for the first time, welcome. And the Khipu 2021 event series in AI is a series of monthly online meetings geared towards supporting the advancement of artificial intelligence talent in Latin America. And in general, each event consists of two series. In the first part, we have conversations on AI with a fireside chat with AI researchers, exploring more critical topics and unsolved problems in AI today. And the second part, we have applications of AI session, where we cover in detail examples of AI applications in the real world, its challenges and opportunities, focusing on a Latin American perspective. So in the previous events we've had, in case you've missed it, in the past months, we've had these amazing events with the speakers you see on the slides. In April, we had an event on reinforcement learning to kick off the series. In May, we had one on self-supervised learning. And then we had one on fairness and bias in AI. And the July Fireside event was with Jeff Hinton. And if you missed any of these meetings, you can see the recaps and recordings on the Khipu Crowdcast profile. And before going on to introducing our speakers today, I'd like to thank all of our sponsors who have made this event possible. And thanks to you as well for attending these events and making Khipu what Khipu is. So I'd like to go on to introduce today's speakers. So today, the session is on artificial intelligence and biomedicine and lessons from the pandemic and future perspectives. So I'm really excited to hear what the speakers have to say today about this important topic. And we have three speakers from Latin America, which is quite exciting as well, talking about AI, the intersection between AI and biomedicine, which is a topic I'm really excited about. So our first speaker would be Gonzalo Moratorio. And Gonzalo received his PhD in molecular biology at the Universidad de República Montevideo, Uruguay. He is currently an associate professor of virology at the School of Science, Universidad de la República in Uruguay, and the head of the Experimental Evolution of Viruses Laboratory at the Institute Pasteur of Montevideo. His research combines both experimental evolution and synthetic biology on RNA viruses and translational research, and he's a co-investigator of a patent to design synthetic RNA viruses as vaccine candidates. And in 2020, he was distinguished as one of the 10 most relevant scientific personalities by the journal Nature, thanks to his work to contain the SARS-CoV-2 pandemic in Uruguay. And our second speaker is Pablo Arbeláez. And Pablo received his PhD with honors in applied mathematics from the University of Paris in 2005. He was a research scientist with the computer vision group at UC Berkeley from 2007 to 2014. And he currently holds a faculty position in the Department of Biomedical Engineering at the Universidad de los Andes in Colombia. And since 2020, he leads the Center for Research and Formation in Artificial Intelligence at the Universidad de los Andes. And his research interests are in computer vision and machine learning, in which he has worked on several problems, including perceptual grouping, object recognition, and the analysis of biomedical images. So in the first part of the session, we have Drs. Gonzalo Moratorio and Pablo Arbeláez speaking, and then we'll have a Q&A with the two of them. And then we'll have Maria Camila Escobar speaking about her work during her PhD in the second part of the session. So welcome to this session, and I'm looking forward to the talks.
Okay. Hi to everyone. Can you listen to me? Can you listen to me?
Yes.
Okay. So first, thanks so much for the invitation. And I need to say that I am a total outsider from the field of artificial intelligence and IT, for example. But this is my view, and the view that probably many scientists and many engineers share about the pandemic. And from my standpoint as a molecular biologist. So the idea is to discuss a bit and to chat, going through these little things that I would like to highlight. Please, if you can mute some of the micros that I can hear them, that would be great. Thanks. Okay. So first, what we could see here on our left side of the screen is how this lady is packing typhus vaccine for shipment. There in that table, there is enough vaccine to inoculate a town of 20,000 people population. On my right, what I can and you can see is basically the first artificial satellite that we humans built, the Sputnik. And of course, uh, below that picture, there is a headline of the newspapers of that time telling that Russians win the race, the space race, doing that against the US. But which are the thing that these pictures have in common is that they were triggered by stress. They were triggered, they were sparked because of a situation of stress. In on one hand, what happened in World War II was that triggered very strongly the vaccine development and surgeries, procedures, and many things, because before the World War II, soldiers died more often of disease than of battle injuries. For example, the ratio of disease to battle death was approximately 5-1 in the Spanish-American War in the US and 2-1 in the Civil War. For example, just to have an idea, the flu in 1918, the badly called the Spanish flu was not originated in Spain, killed more people than the almost 20 million soldiers and civilians that were killed during the World War One. And just this virus killed roughly half of the US military soldiers in Europe. So as the Second World started, the US military recognized that infectious diseases was the most important enemy as any other they would meet on the battlefield. So they started new partnerships with industry and academia and developed vaccines for example, the troops. In the case of the Cold War, clearly the race to dominate the world and show who was the most powerful from a technological standpoint directly impact on computer power and IT advances through the race for the space between the ex-Soviet Union and the US. Our enemy today is this coronavirus, SARS-CoV-2, and the pandemic that it's causing. So again, we have this situation of stress. And this situation of stress are the ones that clearly could produce a knee in a curve, an inflection point in a curve. Here you have, unfortunately, a little old cover from my homeland, Uruguay, that said in your right 5,000 that they are not longer here with us, and the other a Time cover magazine that you could see that how these viruses stop the world. But you in the IT world and the technological world are very familiar to these kind of explanations, but maybe broad audience are not so much, where linear becomes exponential in terms of a disruptive stress or an opportunity. And this is what happened. And I think we are living right now. So there are 4 industrial revolutions, and as you can see, the first, the second, very, very well known, based on many mechanical production, railroads and steam power. But then in just going further, 1850s, mass production, electrical power being transversal to everything, generating a new industry, and the advent of the assembly line clearly gave place to the third one, based on automated production, electronics, and computers. And there, between 1950 and the 2000s, medicine is there and was kind of launching in many things. And after 2000s, you are responsible, and you are the main actors of this AI revolution, with big data, robotics, and more to come. So what I think is that pandemic allow us to reimagine health and medicine, and through biotechnology. And up to now, never biotechnology has met before so tight the power of AI and machine learning and many things that we are living, for example, nowadays, with algorithms like AlphaFold to predict the structure of proteins, or even to predict the structure of RNA molecules. That's amazing, and we are swimming on that. But biotech has been part of our life since long. You can see here insulin antibodies, with the impact in agriculture, and also, of course, by not only creating this, because what is biotechnology? Biotechnology is when we use biology to do and to make very useful things as a technology. And this is when devices and tests and diagnostics are also part of this. And if I focus on that, this is the beginning of the story, where it was clearly show the weakness of clinical diagnostic infrastructure, that they were underfunded, undervalued, underprepared. Laboratory testing has been overwhelmed by the contagion. Testing capacity determines how many cases a country can confirm, and insufficient testing underreport cases and death. More importantly, as economies reopen and sufficient testing relinquishes control of COVID-19, because new virus clusters avoid detection and spark new outbreaks. So we could see how the US, Europe, and every corner in the world failed in testing, and testing was our first weapon to make visible an invisible enemy. This is when I start telling you guys how did I end up here, between, for example, the Prime Minister of New Zealand, who kept on New Zealand for long, even today, with lower number of cases recorded in the world, or the scientist who sequenced the virus, the director of the WHO, the main virologist who I admire a lot of the US as Anthony Fauci, and the thing is that it was not me. it was a team, right? We are a team, and I am one of the persons who is leading this team. But we create a test, and it was not difficult to create the test. What was difficult was to have the timing to see how the wave, how the spread was coming to Uruguay. And Uruguay is located very, very at the south of the south in the world. And that allow us to take this spread as a message of the future and better prepared us. While borders were closed, timing was everything, and we cannot get reagents to start performing our test. Even at that time, we are talking about January, February 2020, they were less than a couple of sequences of the viruses available. So we have the clinical sample, and then we extract the genetic material, and then we look at the traces of the virus. And this is how we see a result using our technique. When a sample is negative, you can see on your left that there is no plot, there is no curve in the screen, and where a sample is positive, you can see it like below on your right. So this was the whole idea to perform Tetris. Tetris basically is test, trace, and isolate. And if you keep below the 4% of the number of tests you are doing, you are able to contain the spread and not allowed to just let the virus win. In terms of speed, the virus will be always much faster than the speed that we have to try to do this testing, tracing, and isolating contacts of people to avoid the spread, the contagion. But one thing that we thought is that, okay, we have the test, but now we can put something very, very, very humble and easy to do. That was to put a bit of machine learning in the analysis of the data of the results that we were doing. So for that, I met a long time ago a friend for very, very, very long time in my life, who is a software developer and has a software company about different things, that he arrived to me to tell, hey, how can we do to help the country, to help you? And of course, we are going to do it for free. And then with him, these other three very talented and somehow a terrific guys like Karina, Santiago, and Santiago, who started working in the lab. They never before had the experience to work in a molecular biology lab, and they just suit up and start processing samples and learning and watching the whole process to just try to end up with this basic idea of that the PCR test consists of a sequence of numbers of length that between 25, 50 numbers, and those number sequences are generated after 40 cycles in the machine to see if we can detect a signal that is coming from the viral genome. So those cycles can be used as features to train any kind of machine learning or deep learning model simply by differentiating the sequence as positive or negative and then feeding the model. And by this binary model, they just create an algorithm that we put in all our machines. And of course, we link the algorithm with the personal cell phone of the patient. So they receive an SMS text just telling them if they were positive or negative to increase the speed of the Tetris strategy. Then what I think that was clearly more difficult was to set up a nationwide SARS-CoV-2 lab diagnosis network. Here we use people from academia, PhD students, master students, that they left for a while their own projects, their own thesis projects, and they just start helping us. They were trained by us to set up this nationwide SARS-CoV-2 lab diagnosis network. And of course, we get the funding, and we start setting up the labs, and we start also looking very, very, very carefully our more than 700 miles dry border with Brazil, when Brazil was and still is one of the epicenters of the pandemic, and a kind of bioreactor of viral variants, just to control the entry. And by doing that, many people work with us, and that was a great experience. We were all around the country. We provide the test, and it was all for free. We never take any profit of this, not even of the intellectual property of our design. And this is how by September 2020, more or less 40% of the tests were publicly carried out by our method. And that was great, because by December 2020 in our country, we had a record that was lower than 100 total deaths. Being the pandemic, with almost 1 year of pandemic here. So the question is, how did the pandemic impact scientific technological development? And I think that clearly, as I started this presentation, the pandemic accelerated, enhanced, and most importantly, it evidenced the existing potential of academia and science. And that all was some part through the biotech arm. And here I probably have that bias, the bias which I told you when I started this presentation, that I was an outsider from your field, guys. And so I have that bio bias in me. So the detection of pathogens, the RNA technology, genomic sequencing, all was entirely enhanced by the pandemic, because we need solutions. And one of the
Gonzalo,
best
just to give you a 5
examples
minute
are RNA vaccines. Oh, perfect.
Okay.
One of the main examples was RNA vaccines. As you can see, RNA vaccines are like a script, a code that by using them, we use our cells as factories to make viral antigens. And this is how these vaccines are so powerful in terms of trigger immune defenses. And also, to do so, these vaccines, they don't require tissue culture cells to make them. So we need just to create this biomolecule that is RNA, and then let our body do its work by using the cells as main factories to make viral antigens and so on, immune defenses. So imagine that now with this kind of situation, there are many pandemics that we can somehow model, and by having this technology, we are going to be able to create antiviral strategies, vaccines like the ones we are using today to face them. As you can see here, with close to 33 million deaths in a global flu pandemic, for example, that the Gates Foundation also modeled here. I think that the other point is virtuality. Clearly, virtuality had and still has an impact that is more than significant in the pandemic. Because before, I think that we were always taking care when people were sick. But now I think there is a change of paradigm, and we are going to move from sick care to healthcare, because virtuality allow us to improve so many devices to monitor our lives, to monitor or to reach people when we couldn't let them go to the hospital, and to measure accurately their metabolism, their many vital signs. And this is how I think, for example, pandemic will clearly impact. Just imagine what if your doctor could predict your heart attack before you had it, and prevent it by all the data, big data, a lot of data and patterns that thanks to AI and many other algorithms, we can start understanding them. And what if your doctor could predict, for example, a neurodegenerative disease before it develops, and prevent it? I think that are the things that virtuality are already enhancing so much because of what we lived in the pandemic. So given said that, I would like to thank you all. And this is what I had to tell you today. Thank you.
Good afternoon, good evening, everyone. Can you hear me? And can you see my screen? Great. So thank you very much, Gonzalo, for this inspiring talk. My name is Pablo Arbeláez. I'm from Colombia, where I lead the Center for Research and Formation in Artificial Intelligence at Universidad de los Andes. Today, I will present you some of the work we do on global health applications. I will first present our center and then describe briefly our global health applications. So here is where we are located, in the northern tip of Latin America. We are in Bogota, the capital of Colombia, and that's on top of the Andes. That's the reason for the name of our university. We are a small private research university, and together with the public National University of Colombia, we are proud to be one of the 2 top schools in the country. We are consistently ranked on the international rankings in the top 10 spots in the region. And within the university, the School of Engineering has 8 departments, around 130 faculty, and all the departments have the accreditation of the Board for Engineering and Technology of the US. So our center is called Center for Research and Formation in Artificial Intelligence, as I told you, Sinfonía for its acronym in Spanish, and we are proud to be the first academic center for our field in the region. Today, the Tecnológico de Monterrey has a hub in AI, which is our partner, and we work closely together. The center is based upon 3 pillars. First, academic excellence, which is the trademark of our institution. Second, responsible research, and I will tell you more about this in a few minutes. And third, ethical principles. We really care about the consequences of the usage of the technologies we develop. Upon these 3 pillars is our mission, which is transforming the world with artificial intelligence for the benefit of humanity. The center has about 25 professors, all of us coming from diverse fields, many of us engineers, but also people from the School of Science and the School of Law also. Each of us with our groups and students. We are proud to be a part of the FAIRLAC initiative of the Inter-American Development Bank, which seeks to highlight the initiatives in the region in AI that affect public policy. And we also have an alliance with DeepMind in terms of scholarships for our students, promoting thus diversity in AI worldwide. Our research is focused on 3 fields: computer vision, sustainability, and then global health. We have a large network of partners with whom we work very closely. In terms of computer vision, that's our main technical expertise. I have worked in computer vision for more than 20 years, and I feel at home within that community and in the computer vision conferences. I have contributed to the field for 15 years now. I have worked on the problems of segmentation and grouping and visual recognition. As a researcher at UC Berkeley, I had a lot of activity on those fields about 10 years ago. And then I have also worked on video analysis. Currently, Sinfonia is participating within the EGO for the University Consortium for building a large data set of egocentric videos. We are also interested by some recent topics within our field, which I personally find very exciting. One of them is the intersection between vision and language. In particular, we have an oral at the upcoming ICCV in collaboration with Google Research Zurich on that topic. We are also working on image generation, and here we collaborate with ETH Zurich and Luke Van Gool's group in the problem of super resolution with GANs. And finally, we have a close collaboration with Kaust and Bernard Ganem's group in adversarial robustness, which is a new domain that I think may hold the key towards interpretability of the networks and the models we train. Many of my colleagues work in sustainable development applications. Of course, that's a key topic in our country. We have projects in problems such as learning for society, social robotics, learning for education, semantic web, and also, as Gonzalo was mentioning, Industry 4.0. Many of my colleagues in industrial engineering work on that topic. Our third domain of application is global health. And I have always been very interested by this domain. When I was at UC Berkeley, I worked in these topics, and here in Uniandes, I am a faculty of the Department of Biomedical Engineering. Therefore, I'm constantly working with colleagues in biology and in medicine. We have several large projects on this topic. The first one is in robot-assisted surgery. We are very active in this domain within the MICAI community. We have won a couple of challenges in the past. In the long term, the goal here is to design a fully autonomous surgical robotic assistant. On the short term, we are working on problems such as instrument recognition, or together with Fundación Santa Fe, a large medical center here in Colombia, we are building a database of actions, of surgical actions. A second project is on lung cancer diagnosis. You may know that that's the type of cancer that provokes most deaths in the world, sadly. And the reason for that is that lung cancer is typically diagnosed very late. It doesn't present symptoms. So when you go to the doctor, typically you're in stage 3 or 4, when your survival chances are really compromised. So the goal here is to do a much earlier diagnosis. And we have been working that project for several years now. We won a Google Research Award for Latin America in 2019 and a Lung Ambition Alliance Award last year for working in this project by combining both the CTs, which is the diagnostic image typically used for this disease, but also, in addition to the image, the clinical data, which is critical for specialists to diagnose the disease. So combining both types of information, we obtain a much accurate diagnosis. A third project in global health is drug discovery. Here we are working on the interaction between pharmacological molecules and proteins of interest within our bodies. We are applying graph convolutional networks to this topic with very great success. We have also a project on Biomedical Segmentation. That one is in collaboration with Amazon Web Services, and in particular, we are studying the problem of adversarial robustness in general biomedical segmentation. We will have a paper at the upcoming MICAI on that problem. Next, we have a project on genetic heart diseases for children. This is a nationwide project founded by the Ministry of Science, and together with all the big clinical partners in the country, we are developing this program for that disease, which is rare but very serious. It is diagnosed during the routine tests of future mothers with the echocardiograms, and it can be diagnosed at 3 months of pregnancy or 6, typically at 6 months, by trained specialists, and by very, very trained specialists even earlier. However, the problem in our country is that most technicians don't have the basic training to perform this diagnosis. So we are developing automated methods to help them during those exams, and we are also having a program to train them and educate them on the use of these technologies. And finally, in response to this pandemic, we have a project on massive COVID-19 testing. However, I won't talk about that one because Maria Camila will highlight it later in the second part of the session. So that was it for a very brief introduction of what we do. Thank you very much, and it is a pleasure for me to be here today.
Thank you, Pablo and Gonzalo, for that. Those really inspiring talks, and it's really great to see these applications. I think one of the things both of you highlighted that was super interesting was the focus on the importance of collaboration. So I really liked, Gonzalo, how you highlighted that the recognition you received from Nature, for example, wasn't just an individual effort, but it was a team effort as well. And I really loved how you highlighted that. It was really interesting, Pablo, to see all of the collaborations that you have as well, bringing together diverse perspectives and having collaborations from both within and outside of South America as well to really drive forward innovation in the space of AI for biomedicine. It's really inspiring. And I'd like to draw out this conversation to ask you, what do you think are the most important ingredients for setting up successful collaborations, especially in the space of AI for biomedicine, which is quite multidisciplinary, multi-collaborative? Can you share some insights on that?
For example, I think that the first step is trying to talk a common language, right? Because as molecular or virologist or even evolutionary biologist, it's difficult when you are trying to make it yourself understand by a person from IT or totally into this area that is every day bigger and bigger. So the thing is trying to share or to be clear in the idea that you have. Sorry, the idea that you have. Then, of course, it is important to be connected with many places in the world. The first things that we did was basically because I received some reagents from Paris. I spent 6 years of my life as a postdoc in Pasteur, the biology department of the Institute Pasteur. And at that time, here borders were closed, and there was only few couriers working, like FedEx or something like that, in the worst moment of the pandemic in the world. And they just sent me some reagents to start working and see if we were able to catch up the virus. So I think that this is a combination between trying to speak a shared language, or to make yourself clear in the idea, and then to be connected with the world.
Yes, I agree. So I think one of the few positive consequences of the pandemic is that it has really spurred scientific collaboration. We have seen within the scientific community much larger groups and efforts, and also, which is equally important, between the academia, the industry, and the public sector. Briefly, it was very difficult for us, for instance, to work with public data. There, in the medical applications, there are large privacy concerns, as is natural. However, as a consequence of this situation we are living, we can be more flexible in sharing that data and in working together. So that's for sure something that we have learned from this pandemic, and also in particular in AI, that was present before the pandemic, but it has also been increased, which is the community level effort. So we work not only within our groups, but we have a culture of open source, reproducibility, constructing the work together, which is key. And we have seen how it has really accelerated the progress in these times.
Yeah, I think this is a really interesting point. Looking at within the scope of how do you set up successful collaborations in AI and biomedicine, I think the pandemic has really taught us many lessons. Can we delve a bit deeper into that? What do you think are the key lessons that we've learned? So if we could reinvent the way we've done AI and biomedicine during the pandemic, what do you think we could have done differently? Or do you think there's anything we could have done differently to help to progress this field further?
Well, I would say...
Pablo, would you like to take this one first?
Sure. So I would say data availability and transparency right away, since the beginning, in all the aspects of the pandemic, right? Its origins, how it's evolving, the epidemic in each country, etc. So there really, so without accurate data, science can do very little, and we could have done better, definitely, as a species, I would say.
I would add that talking about data, there's never in our history has been a pathogen so much and so well characterized like SARS-CoV-2, because of all these redirection of every effort, every scientist, every engineer, every health worker to try to provide valuable information, because information is a way that we need to solve issues, to understand mechanisms, to think about it, how to detect, how to prevent, and sure, all that data, if we compare all the papers, all the scientific publications published in history about dengue, about polio together, are much fewer than what we have already published of SARS-CoV-2, and that's important. We need AI, we need many of these technologies to understand so much data and to find meaningful patterns among them.
Thank you very much for those insights. I'd like to shift the conversation a bit towards, so both of you have given really inspiring talks, and it's really amazing to see the sort of career trajectory that you've both had. very successful careers, and to think that, you know, these successful careers have culminated in really having a real impact in shaping the response to the pandemic as well, and a successful response to the pandemic. And this is really quite inspiring. I'd like to know, so speaking to us as people who've sort of just started off with journeys in AI for healthcare, AI and biomedicine, how do you decide what to work on? What inspired you to start this, to sort of place bets in where to work and what sort of research to do? Pablo, do you want to?
Sure, what to work on?
Go.
So, there are a couple of things there. And one of them, of course, is data availability, right? So when this pandemic started, we really wanted to help. We had many ideas in which we could, many problems in which we could apply machine learning successfully, but we didn't have the data, right? So by and large, the problems we study are determined by the data we have. Some of them are interesting, but we simply don't have it to study them. And also by our partners. So we work, as we were discussing previously, within a network. So their problems and their worries are also a fuel for us to guide our work.
From my point of view, something that is somehow as the holy grail is to understand evolution, try to predict evolution. Now we are in the middle of a storm of viral variants, and the question is, which is the next mutation that can face and really struggle in terms of the vaccines that we have. I think that it's gonna be almost impossible to predict evolution, but with so much data as has never been in terms of millions and millions of sequences and viral genomes, if there is a way to get closer to that question, is by artificial intelligence, is by algorithms like AlphaFold, understanding how, for example, macromolecules has to fold into themselves or like that. So I think that the working together with applied mathematicians, engineers, is the way to try to see, okay, this is the work that I would like to move or to guide in within this context, right?
Okay, we have a couple of questions from the audience, but before going to those, I wanted to ask, so for people who want to go into this field, what advice would you give for what sort of courses they should take? How do you get involved in this sort of field?
So in regarding to my field, is that is mandatory to go abroad, to study in different places, to meet different people, and try to meet the people who is writing or shaping the area that you are working on. It is important that in academia is not about winning anything. It's about never giving up. Experimentation and laboratory are very difficult things to deal with, and there is a lot of frustration because usually experiments do not work as you expect, and you need to understand that that is part of the road, is part of the way that you take it, and moving, and also knocking every door that they can. It's important to talk with people, to talk with scientists, to write them, to ask them if they have a place to receive them, and try to to go and see the world, and in the world in terms of in my case the virology like world, right?
Yes, of course. I can only agree with Gonzalo. To research and science, you really need a lot of passion and curiosity. So for AI, we have the luxury of being a very trendy topic nowadays. So you don't need to do a full PhD in AI to learn about this field. There are many available channels and ways of learning about this at every level. So there are online courses, programs, etc., in which you can really go as deep as you want in deep learning. So the advice is for everyone who is interested in AI, just dive in, go for it. It is a lovely field and it's very timely.
Cool. I'll just take a couple of questions from the audience. So the first question is from Anna, and she asks, is there any disease without treatments that with the evolution of technology and knowledge coming from the pandemic began to see a path to treatment?
I would say that many of them. Just if we think in the RNA technology, the technology used for Pfizer or Moderna vaccines, currently we have, for example, HIV vaccine in an advanced clinical trial. On the other hand, we also have the idea, and they are moving faster, of making anti-tumoral vaccines, because we can analyze a protein in the tumor. Is kind of a personalized vaccine of a person, and then design the RNA that will just call the immune system to attack that protein in that tumor. And I think that RNA technology has arrived to change biomedicine, and RNA technology plus AI in terms of data, and teach to the RNA how to swim and find the target. That's gonna be awesome.
Okay, anything you'd like to add, Pablo, to that?
No, of course, Gonzalo is the expert about diseases.
Yeah, it's quite inspiring times, actually, in this respect. So final question from Dixon, from the audience. And I think this is a great question as well. So what gets you out of bed in the morning, and what is your motivation in life? Pablo.
So what gets me out of bed in the morning? Well, the passion for what I do. I really like my work, and having an impact, working in such a technical field and having the opportunity of have an impact in the real world is really unique. So I really love that about my work. So the second question was about what?
Your motivation in life.
Oh, my motivation, yes. So changing the world for good, hopefully.
Gonzalo.
Okay, so what gets me out in the bed, besides coffee? no, let's say, of course, I mean, the passion that we have for what we do. Um, I think that you need to pick something that really, really, really drives your motivation, and to work here and work with my team, and the students, and the environment that is created in the academy. Those are factors that are important to waking up, and to try to see that, I mean, before the pandemic, all the science that I did in my life never reaches society, or you could see a change, right? But since this started, um, I had to redirect my projects, my science, to do a sort of an assistential science, and working on other things, and that was super good. Also, I am missing a lot my projects, and little by little I am reactivating them. But I think that waking up and coming to work, because I am happy in the lab. I am really happy in doing what I'm doing.
Okay, thank you so much, Pablo and Gonzalo, for those really inspiring talks, and a great discussion, but also for the work you do as well. Thanks for these insights, and it's been really interesting discussing this with you. So hopefully the audience can reach out as well with more questions if they have in the future. But thank you so much for this. It's really great to see your work. With this, I'll introduce the next speaker. So Maria Camila Escobar Palomeque, has a master's in biomedical engineering, and she's a PhD student and researcher of the Centro de Formación y Investigación en Inteligencia Artificial of the Universidad de los Andes. Her research experience is focused in the development of AI algorithms for medicine. She is currently part of a team working on AI tools to improve massive testing of COVID-19, and her main interest is to bridge the gap between AI algorithms and medical applications. So I'm really excited to hear Maria's talk, and over to you, Maria.
Hello, everyone. I hope you can hear me now. I will start sharing my screen. Let's see. I think you can see it now. Okay. So, hi everyone, my name is Maria Escobar, and I will be talking to you about smart pooling, which is an AI-powered strategy for COVID-19 testing. So before starting, I would like to highlight that this is a very huge project. It has a lot of support from national and international entities, and it is directed at Universidad de los Andes in Bogotá, Colombia, by Professor Pablo Arbeláez, that you already saw, and by Dr. Silvia Restrepo. So to give you a little bit of context, I usually give this presentation and I talk about COVID-19 and the amount of deaths that have been happening, and the amount of people that have been that have contracted COVID-19. But I think this context is not necessary enough. We already know it, and Dr. Gonzalo was talking about it. But what I wanted to give you context on is the importance of testing. So as Dr. Gonzalo was telling us, testing is really important, especially in identifying COVID-19 and in trying to manage the disease, the spread of the disease. But something that many of us are not aware is that testing is now at a very complicated stage, because testing is running low as COVID infection source. So what you're seeing now is an article from Reuters. This is from 3 days ago. And I encourage you to check this article after our presentation. It's a 2-minute video. And what they're telling is, well, we want to reopen things. We want to reopen schools, universities, and everything, but we need to know that we have control over the disease. And the only way to do this is by testing, by knowing if everyone who's going to school or to university is safe. And this is not happening because we are in short supply of tests. So the places that make the testing are not making as much as they used to. And this is a problem because with the Delta variant and everything, we need to increase the testing capacity. This is what's happening in places like USA. When I translate this to where I'm from, which is Colombia, it is a lot more complicated because we don't even make the test. So testing is really important, but we don't have the resources to do it in the massive scale that we should be doing it. So this project was born more than a year ago in March, I think. And what we were thinking was, well, how can we make testing more accessible for everyone with the tools that we have? And in order to give you a context of what smart pooling is and how we came up with it, I'll first start telling you how are things done right now. So usually what people do is, or what labs do, are individual testings. And individual testings, you have, for example, a group of people like this one, which is 100 people, and then one of them has COVID, but we don't know that yet. And we will do an individual PCR testing for each of these people. So then what we have is that we have one test result for each of these persons. And then what we have is 100 tests that we took to evaluate 100 people. So this would be an efficiency of 100%. Then there are other strategies like two-step pooling, which is a strategy that has been used for a long time. It was developed in the Second World War. And what they say is, well, if we have all these people and we are gonna do tests, we don't have to do an individual testing. So we don't have to use one kit for each of the patients, but we could group them. So we create a group of, say, 10 people, 10 pools, 10 patients, and then we take the samples from each of the patients and we mix them in just one testing kit. This means that if the testing kit is negative, every person in that pool is negative. Otherwise, if the testing kit is positive, at least one person in the pool is positive. So what I need to do then is to go to this group and evaluate individually each of these persons in order to identify which one has COVID-19. In this strategy, we are still testing every person, but we are saving kits and thus making it more efficient. In this example, we only use 20 tests for evaluating 100 people. So I know that you see this and you say, well, this is very effective. Why are we not using this right now in the pandemic? Well, this works for a low prevalence, so a low positivity rate. In this example, we only have one positive out of 100. But when we have something like what we are seeing right now in Colombia, which is a 35% prevalence, which is pretty high, well, two-step pooling is not going to be effective. As many of you have already imagined, if we have this sort of example, well, we have to do the pool PCR, which is the grouped one, and then all of the test results are going to be positive. So then we have to do individual testing for each of these patients, and then we end up using more tests than we initially had to. So we are using 110 tests when we should be using 100 maximum. So this is something we obviously don't want to do, and it would be completely not useful for the pandemic. It wouldn't be useful. So what we present is smart pooling, and smart pooling is a way of using two-level pooling, but in a new way in order to improve its efficiency. So we have the same example that I was showing you about, and what we thought was, well, these people that you see here, and especially the ones that are in red, they probably have some things in common. They probably have been in contact with someone who has COVID, or they have symptoms, or they probably have traveled overseas. And we can use this information to use AI order pools. So we can predict which of these patients are going to be positive or which are going to be negative, and then group them in order to have the positive groups together and the negative groups together. Then when we perform pool testing, like I was telling you, you see that we will have some tests that are positive and some that are negative. In this way, even though we have a high prevalence, we are able to increase the efficiency of pooling to using only 50 tests for 100 people. So this would be an equivalent of an efficiency of 200%. This is the idea behind smart pooling. The lab is still testing every person, but we are helping it to be more efficient. How does it work in practice? So first, the lab collects the patient's swab and clinical data. This clinical data is sent to us, and we do a data processing and smart ordering. What we do is that we use machine learning models in order to predict if the patient is going to be positive or negative. And then we send the lab an information of how to organize their samples into pools. So basically what we send them is an Excel sheet telling them patient 75 should be in pool 1, patient 85 should be in pool 2, and all this information. Then the lab performs the testing, and then they tell us how the testing went. So this is important because we need to retrain our models. Our models are not perfect, so we need to make them better every time, and we do this by continuous learning. This is the entire pipeline of smart pooling. This is a pipeline we have worked with along with the labs in order to make them easier for them and to make this an accessible strategy. So in order talking about implementation, we have established an alliance with the health department of Bogota, which is the capital city of Colombia, with the support of the Rockefeller Foundation in order to implement smart pooling in Bogota. So why is it relevant to do this? Well, the ICU's occupation in Bogota have surpassed 90%. We are right now at a lower level, but we have been there. And the positivity rate is higher than 30%. This is really alarming numbers, and we need to do something to help. So how do we train our models? Our AI models are trained with a historical data set of more than 1 million patients, which is the amount of patients that the city of Bogota has been able to test during the pandemic. And I want to show you how would smart pooling help. So in this graph, what you will see is first in the x-axis, you will see the prevalence, which is the positivity rate. So the higher this number, the worst case we are in the pandemic. And then we will see in the y-axis the efficiency, which is what I was telling you about how many people we can evaluate with how many tests. So this dotted line that you see here is individual testing. When we do what every lab is doing right now, we have an efficiency of 1, which is 100%. And then this pink area, pink reddish area, is where we don't want to be. Why? Because we don't want to be where we don't get any improvement. Under individual testing, where we're just not being efficient. So as I was telling you, traditional two-level pooling is not efficient after 30%. So we couldn't use it right now because we would be losing tests, and that's less than ideal. In contrast, if we used smart pooling, we would be having a higher efficiency for any prevalence in the response to the pandemic. So what we really like about this is that it's not only better than two-level pooling, which starts being bad at some point, but it's also better than individual testing every time. So in order to put this in context, if the laboratory is using a pool size of 6, so the example I was telling you was grouping people in 10 people for each group. Here, if we have 6 people for each group, we would have at a 35% prevalence, which is around here in the graph. Smart pooling reaches an efficiency of 167%. And this means that with 1,000 testing kits, we could evaluate 1,770 patients. With individual testing, we could only evaluate 1,000 patients. So this is very, you can grow this method in order to evaluate a lot more patients. Something that also is very interesting for us is that smart pooling has efficiency gains even at critical conditions of the pandemic. So if we are at a 50 or 60% of positivity rate, which is extremely high, we could be helping, and we could help to make the testing more efficient. And this is what we need when the pandemic is getting worse. So this is a practical example of how many samples smart pooling could help increase in Bogota. So these are the daily samples in Bogota that were done from the 1st of January till mid-April. And then this is what was done with individual testing. If we had used smart pooling at that time, we could have done increasingly a lot more tested, evaluated a lot more samples, and specifically 95,000 samples. And this would be, considering that each sample would cost around $50, this would be around $4 million. So it's not only helping more people, we would be saving money in order to invest this money in other responses to the pandemic, and that's why we're implementing it and trying to make it work. So to close this presentation, what is the impact that we want to have with smart pooling? First, it does not replace molecular testing. We never meant it to be a replace. It is not going to do it. In contrast, what it does is it enhances massive testing. So we are using our resources in order to increase the amount of massing testing that the labs can do. It is easy to implement in laboratories, and this was one of our main goals, because we don't want to put more responsibilities to the people that are in the front lines helping us with the pandemic. It is also robust to different type of data and populations. We know that the development of the pandemic is not the same in Uruguay as it is in Colombia, so we would have to train different methods and different models to adapt to each data and to the evolvement of the pandemic. And then we can also provide a detailed analysis to complement molecular testing. Since our models include epidemiological data, then we are able to give a detailed analysis of what is going on. Another really cool thing that we think about smart pooling is that it can be used outside from COVID-19. So we are not restricted to COVID-19. It can be used with any other disease that is able to perform pooling. So there are others, and it could be used after the pandemic. So to close, we are looking for alliances to implement smart pooling worldwide. We are doing this right now in Colombia, but we would like to extend it everywhere. We think that it could really help. And it is an example of how we can use ethically AI for social good. So thank you for hearing me. If you want more information, here is the webpage of Sinfonía. You can also send me an email and I'll get in touch with you. Your mic is not on, Daniel.
Thank you. Sorry. I was just saying thanks so much for this really inspiring work and great piece of work. So I had a couple of questions. The first was, what methods do you use, or do you have some way of validating the estimates of efficacy coverage of your approach to smart pooling?
Yes. So to validate our efficacy, or well, the performance of our models, we use a machine learning model. So we use something that's called automated machine learning. In this way, we ensure that we have the best parameters for the model, and we focus only on the data. And then how do we ensure that it is being accurate? Well, what we do is that we have historical data from the city of Bogota, and they give us the epidemiological data and then the results. So this was positive, negative, everything. And we do a blind testing. So we say, if we take this month and we evaluate, but we don't know the result, how well would our model perform? We use for validation the metrics of precision and recall, which are how good we are at identifying these positives.
Thank you so much. And what kind of information do you use from patients as well for the predictions? And also, what kind of algorithms do you use for the predictive part of the model as well?
So for information, we have a variety of information, because we think that we cannot use only symptoms, because then symptoms would be, what about asymptomatic people? So we use epidemiological information, we would be symptoms and any other type of illnesses that are related to having a higher rate of COVID or something. And then we also use information of the patient, like where do they work? Do they work at a place that requires social distancing, or do they work in public transport? Like all these type of things. Also, where do they live? If their area where they live has a high rate of COVID or not. We have this type of information. And for the model, as I was telling you, we use something that's called automated machine learning. Mm-hmm. This helps us to identify the best type of model. We're not using deep learning with these types of model data because they're not deep enough. The data we have is not structured enough in order to move to deep learning.
Okay, cool. Thank you so much, Maria Camila, for this really interesting piece of work, and good luck with the future of this work as well. It's really great. Good. So with that, I'd like to close off the session. Let me see if I share my slide. Right. So I'm excited to announce the next session, which is for the next September event is going to be on graph neural networks. So we have a session with Juan Bruno from NYU and also with Alejandro Ribeiro from Penn University, and more speakers will be announced later. So watch out for the September event. And finally, keep in touch. Thank you for participating in these conversations in AI, and keep your questions coming as well. And also keep in touch with the various channels we have. So you can watch previous sessions and this session as well on via Crowdcast on the website, khipu.ai. Also, we have the Slack channel, their feedback forms as well, and also follow us on Twitter. Thank you so much to our speakers, Gonzalo, Pablo, and Maria Camila. Those were great talks. Very exciting to hear about the lessons from the pandemic of how we can use artificial intelligence to really push forward the field of biomedicine. And thank you for sharing these inspiring stories as well. And thanks to everyone who's participated in this event. I see there are 147 people, so that's great. I hope you enjoyed this session and enjoy the rest of your evening. Bye.